For our final hour together, we have a panel discussion led by Pete DeMarco, Executive Vice President of Advocacy and Research for the IAPMO Group. Pete's responsibilities include input into IAPMO's Government Relations Department, water efficiency and green building initiatives, standards development activities, domestic and international plumbing programs, the industry outreach programs, and development of research projects relating to the water efficiency. Pete is joined by Dr. Michael Gormley, Associate Professor and Director of the Institute for Sustainable Building Design at Heriot University in Edinburgh, Scotland. Also on the panel is Dr. Andy Whelton, Associate Professor of Civil, Environmental, and Ecological Engineering at Purdue University in Indiana, USC. And last but not least is Christopher Lohr, IAPMO's Vice President of Strategic Initiatives. Pete, to hand the mic over.
Thanks so much, Chairman Bigley. Appreciate that, and I appreciate you handling the introductions for me as well. That was I didn't know you were going to do that, but I appreciate it. And I'm very pleased tonight to moderate tonight's panel discussion on plumbing system implications related to COVID-19. You know, when the news of the pandemic first broke and we realized that we were dealing with a corona type virus, I think the first thought that many of us had in the plumbing industry was the extent to which you know, this virus was going to be transmissible through plumbing systems, much like the 2003 SARS epidemic virus was. In fact, back in February, there was news of an outbreak in Hong Kong, again in a high rise, where the plumbing system was implicated. Little did we know at that time, however, that this virus, the SARS-CoV-2 virus, was airborne and even more dangerous and insidious than the prior SARS outbreak virus. And if there is a silver lining to this horrible global event, I'm hopeful, as Dr. Henry Huang mentioned earlier, and also mentioned briefly by Maggie in her presentation, that we can now focus more directly on the building sciences and the attention that we need to take to improve the potential for buildings to transmit disease. This needs to be a focus that persists after this pandemic is built under control, and certainly an increased attention to our plumbing systems is critical in that effort, and can lead to fewer illnesses and better medical outcomes as a result. So tonight, indeed, we do have a small but outstanding panel of experts that will share their knowledge and experiences on the topic. So getting right to it, I'd like to direct this first question to Dr. Michael Gormley. Michael, in 2003, again, you know, referring back to the SARS epidemic, concerns were raised about the spread of SARS via building wastewater systems. What can you tell us today about the state of the current research in terms of evidence that suggests that SARS-CoV-2 or COVID-19 can be spread in a similar manner through wastewater systems?
Thank you, Pete, and Tom for the introduction. It's lovely to be here. It's WPC. It's quite late in the evening here, but it's lovely to be with you. It's a good question, Pete. There's still quite a lot we don't know about this virus. We've been struggling with it for most of this year, as everyone knows, and we have some anecdotal evidence of spread through buildings. We also have some more tangible published evidence from Kang in China with our friend Yu-Gi-Oh Lee, who was involved in that as well and doing some modeling on it. That's the most extensive epidemiological study on spread within buildings, but there's still quite a lot of unknowns. We can deal with what we do know to start with. First of all, we know that the virus is shed in feces and in urine. That's easily picked up using PCR testing for just looking for the RNA of the virus, but it doesn't tell us if the virus is infectious, and the infectivity of the virus is what will determine whether it can spread through the system. But we don't know that, because it turns out it's a very specialist and a very difficult task to prove infectivity. It's much easier just to pick it up in, as I say, from doing PCR testing in RNA. So there's a lot of work going on at the moment in wastewater systems outside of buildings, where a lot of utility companies and local authorities and environmental protection agencies are looking at the prevalence of the virus in wastewater systems, and there is evidence that you can link levels of the virus in wastewater systems to the prevalence in a community. So there's a little bit of epidemiological work that goes on in that, and a bit of surveillance that goes on in wastewater systems. But when we come inside the buildings, it's much more difficult. As we all know, the plumbing system is hidden away. People don't want to look at it. People don't want to go anywhere near it. Even the discussion from Kevin, I think it was at the very beginning, about putting down toilet lids, that is controversial for a lot of people, so we have a difficulty when we come inside the building. The risk is not proven, actually. It is just simply not proven. But what we do know is that it is shed in feces and urine. We know that there's the possibility of aerosolization of those inside the plumbing systems. Diarrhea is a feature of COVID-19. So that, as was the case back in 2003, that aids transmission within the building. And we do know that occasionally we have defects in buildings which allow these aerosolized pathogens of any kind to come out. So the case is still in the balance as to whether transmission can occur, but it has not been proven otherwise as well. So I think from an industry point of view, there is still the case that we should assume that it's possible until it is proven otherwise. What's the expression? The absence of evidence is not evidence of absence, and we must work on that basis. So until some definitive work is done on the infectivity of aerosolized feces and urine, and until we get a better understanding of how the virus survives in environments, different environments, then we won't know for definite. But we do know that the conditions exist for this to happen, and I think that is I think it's close to the most up-to-date situation at the moment.
Well, thanks, Michael. Appreciate it. Great answer. I should have mentioned before I started with the questions, so please, to our attendees tonight, please do type your questions that you'd like to address to any of the specific panelists in the notes section. I'll do my best to monitor that. And after we go through a couple of rounds with each presenter, I do intend to open the floor to questions from the attendees. So please do submit your questions in that way. Next question is for Dr. Whelton. And, Dr. Whelton has been a researcher, was awarded a grant by the EPA a few years back to research into the into Legionella in plumbing systems. And when buildings shut down because of the COVID pandemic, starting in March here in the US anyway, on a wide scale, one of the first thoughts that occurred to many of us in the plumbing system was to address the issue of stagnation. And it would be a shame to emerge from this pandemic, from COVID, and then see a spike in Legionella illnesses due to folks going back into buildings with stagnant water systems. So Dr. Whelton is an expert to the extreme on the issue of Legionella in building water systems. So the question, Dr. Whelton, is, what have you seen in buildings that have been impacted by the pandemic? What's really kind of set your hair on fire, I guess, more than anything else regarding risks that you've identified? Whether they're related to COVID or not, but in your work of investigating the COVID in buildings, what have you encountered?
So thank you for having me. Thank you for the opportunity to be here and to see so many smiling faces from across the globe. Out somebody's windows, it's dark out and it's morning time, and it's really awesome to see this global effort here. Yes. After the pandemic began and started taking hold in the U.S. and stay-at-home orders were issued, our concern was, butterflies in the stomach. We're going to have a whole bunch of pond water in all these buildings while everybody's away. And so we, in a number of different universities that we're aware of in the U.S., Canada, and even in Europe and in Asia, started working on doing testing, getting a baseline, trying to understand what's going to happen. And over the next several months, some of us did see, you could call them blooms of Legionella, very, very high levels of Legionella in some buildings. But in other buildings, we didn't really see that kind of changes. We did see high levels of metals, copper, zinc, lead in some places just due to the accumulation of those metals from leaching from plumbing components. But in other places we didn't. And so one of the issues that the research community is really coming to terms with now is this theory that if you have stagnation, there may be problems, but it doesn't necessarily guarantee problems under certain timescales. And so this precautionary principle that I think the first speaker was talking about, we have to assume that there are conditions that stagnation will cause the water to, quote, go bad, and we could have some challenges with. And so we need to really understand that. But the precautionary principle is, let's assume that stagnation is not necessarily a great thing to happen, and take actions to move that old water out of the system.
Thanks, Dr. Whelton. Next question's for Christoph. And Christoph's an expert on water treatment and has done a lot of work in his young career and in treatment technologies that work to reduce the risks from pathogens in the water. So the question is, Christoph, regarding ozone being utilized, is frequent utilization as a supplemental disinfectant? How does it interact with the building environment? Because obviously this is an increasing way to approach to dealing with treating water systems.
That's a great question, Pete, and really, there's the whole concept of disinfectants and how they interact with the built environment. You can take that question and build off of it. It's been interesting to see a trend here in the U.S. where utilizing point of use ozone to try to disinfect water as it's coming out of a faucet or at the point of use. And in part, it's because ozone has, as many of our callers probably are aware, it has a very short residual. And when we talk about supplemental disinfection, a quick note on definitions, typically in the water treatment industry, primary or secondary disinfection was typically referring to the treatment that's done at the water treatment plant. Supplemental disinfection, when you are a supplemental disinfection provider, is something that you do at the building. And so again, when we talk about supplemental disinfection, we're talking at the building. Now, taking that question of ozone is very reactive. And so, some of the concerns that I have from the literature that I've seen is there's potential for interaction with piping. One of the more common piping materials is cast iron. And some of that literature is still coming out. And that really kind of, when I look at plumbing systems, it's been interesting for me to see this trend over the last several years where we have this shift in the U.S. at least to going towards more supplemental disinfection, adding some kind of chemical to the water inside the building. And one of the things that seems to be missing with some of this is this holistic approach and seeing how all of these things interact with one another, and making sure that we don't end up in a situation where we put in something that could potentially cause corrosion, or where additional code requirements come into play. An example of that is chlorine. I actually did a Great Wolf Lodge project here in Phoenix. We had a chlorine room, very similar to what obviously smaller, much larger scale for a pool versus for treatment in a building. But chlorine is a hazardous material. And so when we consider how we interact with the built environment, chlorine being a hazardous material, we need to have ventilation for that, mechanical ventilation, and that falls right under the mechanical codes. And a lot of times engineers don't necessarily consider that, or when a supplemental supplier comes in, they don't necessarily consider that impact. Additionally, OSHA and ANSI requirements come into play. We need an emergency shower and eye wash. If something happens with that chemical as it's treated, and the treater's in there and they get it in their eyes or on their body, they need to be within 10 seconds of the emergency shower and eye wash. So, when we start talking about supplemental disinfection, whether it's ozone, chlorine, chloramines, copper sulfonization, we need to be making sure that whatever we have in the building, in the built environment, that A, that it's compatible, but B, also that we're making sure that all the requirements are being followed and that we're considering what it is exactly that we're bringing into the building. And that holistic approach is something that I've seen not fully considered during the process of trying to reduce things like Legionella and some of the stuff that we're seeing even now with COVID.
Thank you, Christoph. Great answer. Going back to Dr. Whelton, you've been again, in your experience going into buildings and evaluating the water quality in those buildings. Tell us what kind of types of buildings you've evaluated to date, and have you noticed, or have any of the buildings had water management plans in place where they're actively monitoring their water systems and taking actions when different control areas get out of range? What can you tell us about the state of the art of water management programs?
So we haven't been in any healthcare facilities during the pandemic. Healthcare facilities in the US have to follow strict understanding of trying to reduce the potential for waterborne disease outbreaks. So generally they hire external consultants, they pay them a lot of money. They do sometimes in building treatment, they do all these. That's a very small amount of the buildings in the United States. We've gone into schools, 1,000, 1,500 kids schools. We've gone into daycare centers. We've gone into office buildings. We've even gone onto multiple university campuses. And in every situation, they didn't know what a water management plan or program was. Many people just relied on the maintenance folks, if they had any, to know where the pipes were. And so when they were faced with, recommendations from, say, the Centers for Disease Control, the federal public health agency for the US, telling people to go flush your pipes, they didn't really know what that meant. And so we have a huge education need in the United States for building owners to understand that they have pipes behind their walls and under their feet that they need to pay attention to. And there's also a need, especially for some consultants, there's just a wide array of expertise in consulting world where, some that we've encountered didn't necessarily know what they were doing and gave bad advice to institutions. And then those institutions got in trouble with the state health agency because what they did wasn't, remediating the problem. And then there's some other situations where the health agencies, like they have a zero tolerance for Legionella. So they don't really pay attention to the risk, right? So if you have a long-term care facility and you have Legionella at 1,000 CFUs per mil out of shower, that's a problem. Or if you have, in a hot shower, but if you have, some like 1 CFU per mil in a drinking water fountain where adults and non-immunocompromised people are. Some health departments, some government agencies said that's equally as important as a problem. You must eradicate that organism. And so they would call for full building disinfection. And that happened at a building where there was 400 water outlets at a school. And we found very, very, very low levels of Legionella that wouldn't, according to the National Academy of Sciences, Engineering, and Mathematics Expert Committee on Legionella, wouldn't pose a health risk. But the health department said, this is our policy, you shall eradicate. They brought in a consultant for $20,000 to disinfect the whole system. So it's a wide array of different approaches taking to find problems or not find problems, to address problems. And right now in the US, there's a lot of anxiety by building owners because they don't necessarily want to test, but their insurance companies now, I'm told, are talking about not covering them if there's any problems with their water system that's linked back to illnesses or God forbid, fatalities.
Yeah, I do believe that the insurance industry and probably the legal industry as well, when they get the tort cases, will be looking at taking advantage of that issue and making sure that, that if there are outbreaks, where there are not water management systems in place, that that will be a major liability for building owners. And going forward, I think that's going to be a driver, as you said, for getting better, more and better water management plans in place. Thanks for the answer, Dr. Whelton. Going back to Dr. Gormley. Very few, after the outbreak, there were dozens, if not hundreds, of guidance documents that were put out for various organizations on different ways to deal with mediating building water systems, getting rid of the stagnant water, and it ranged all over the place. And but precious few addressed the sanitary system at all. It was as if it just wasn't there. And with your experiences and your extensive research on pathogens, opportunistic pathogens that exist in the sanitary system, what should we be considering for reducing the potential for disease spread through the building wastewater system? What are the top 2 or 3 things that can be done to reduce that potential? And how do we get the word out? That it's not just the supply system that we're worried, especially with this particular pandemic. Being a COVID, a SARS type virus with the history of it, it was amazing to me that so few guidance documents mentioned the sanitary system. But regardless, I'd like to hear from you on those 2 points. What are the what should we be considering as the most important things to look for, and how do we get the word out?
Yeah, thanks, Pete. Yeah, there's the question. I refer back to what Andrew said a little while ago. Building owners, they really don't want to know where their pipes are. They don't care where their pipes are, actually, to be honest. A lot of the time, it's not entirely true. But where I think the two systems are very different is that on the water supply side, there are quite a lot of regulations about, because you're providing drinking water. There's regulations about Legionella, but also water quality and levels of heavy metals and everything. There's quite a lot of regulation on the water supply side, and there really isn't any on the sanitation side. So there's nothing that makes people sit up and say, well, we have to do something about this. So it's and this kind of links the 2 questions a little bit. So when you go along and say, right, I've got a problem here that you need to think about, you don't really want to think about it because you've got enough problems on your plate. You've got to deal with all these regulations over here, but I think you really need to deal with this one as well. It just doesn't get the same traction within the organization. There's also, I mean, I think all of us who've worked in drainage and sanitation for years just know there's just so many myths around about what happens and how things work, and people come up with all sorts of crazy science. My principle has been actually to go back to the science actually, and to let's put down, let's prove some of these transmission pathways if we have, and we proved it with bacteria a few years ago, and flowing and airflows, and that one paper actually has gone a long way to convince a lot of people in policy areas here in the UK, but also there is the need to convince people of a clinical background. So and they're not easily convinced. So you've got to hit them with hard science to say, look, these are the numbers. This is what happens when you do this. This is how this can occur. And they will, and people will then make a decision as to what the relative risk of that is. And going back a little bit to risk, you're going to stop me here, Pete, if I keep going too long. But going back to relative risk, there's a couple of aspects to risk for this. So when you look at it from a relative risk point of view, so if you look at it from a whole population point of view, if you look at it in the United States, United Kingdom, or any other country, and you say, well, what's the risk of spread of COVID-19, let's say, because it's what we're talking about here. What's the risk of COVID-19 significantly spreading through plumbing systems? And as I said previously, we don't have enough evidence yet to say that it's a big problem, but there isn't enough, if you like, sort of epidemiological evidence, and there isn't enough evidence for fecal oral transmission route for people to say, oh, well, that's a massive problem. There's a bigger problem with people not sanitizing bathrooms, for example, or closing toilet lids rather than some of the other stuff. But when you look at the risk of an individual becoming infected, then it can become an issue if you've got a defect in your sanitary system. So these risks, they're not always measured in the same way. So on a national basis, it may not be a massive thing, but in this forum here, in the World Plumbing Forum, it specifically relates to the business, if you like. It relates to the plumbing system, and therefore the risk we should be going for is zero. We should be heading towards that. So I think to summarize the answer, using building science, hard numbers to prove that these are issues, or discount them if they're not. I think it's quite important that we do that. We just say, that isn't really a problem. And I do think, there's a case for introducing some form of regulation on the sanitation side, on the sanitary side. And that's why you haven't seen so much in the guidance documents afterwards. And also they didn't really know what to do with it. I've spoken to a few organizations around the world, and they've just said, well, just run the taps, let's fill up the traps, and that will do. But that doesn't mean the whole place could be completely contaminated by that stage, all the surfaces and everything. So
sure, floor drains, everything else. So a lot of drains that could be dry that don't get filled from tap use.
Absolutely. So the guidance should be stronger. It's a battle, though. It's a real battle, and I've had this battle with public health officials here and policy people, and I think it's incumbent on those of us who are involved in research in this area to provide the evidence, actually, and it has to be hard, cold evidence, not emotional or we think this. There's been enough of that, I think.
Right. Thanks, Michael. This one's for Mr. Lohr. Christoph, when it comes to treating plumbing systems, I think one piece of information that's gotten out is that fairly effectively is that if you elevate temperature, you can work to kill whatever Legionella may be in the plumbing system, or such is the thought process anyway. I'd like to hear your thoughts on only using hot water, elevated temperatures as a mitigating strategy for Legionella or any opportunistic pathogen in the building supply system.
That's a great question, Pete. And it's funny because my evolution on this thinking has really occurred over the last, especially 5 years, as I've dove deeper and deeper into this world. And what I'm seeing as sort of a consensus, at least here again in the industry organizations that the committees that I lead and I'm a part of here in the U.S. they're working on creating guidelines. What I'm sensing as a consensus is coming around is if you were to, most engineers, we look for kind of a binary, right, wrong answer in many ways. And when we cross this divide, especially on plumbing engineering, we start having to deal with probability. And we're dealing with a spectrum and shades of gray instead of one size or a yes/no answer. And I want to kind of piggyback a little bit on what Andrew was saying. With the varying range of expertise that you can find with some of the consultants out there. And I'll say, this to me, before I dive into the question of the hot water answer, this to me is such an indicator. What Andrew has noticed. Because I've noticed the same thing. There's a need in consulting engineering specifically to develop a specialization and expertise. And I can tell our audience here from my personal experience, I've seen there's a lot of consulting engineers that do both HVAC and plumbing design, and the deposit of knowledge that it takes to really do plumbing engineering has grown exponentially, especially in the last several decades. And so it's becoming increasingly difficult to know everything on HVAC and know everything on plumbing. And I've also seen this need to really elevate the entire plumbing engineering profession, or those that design plumbing systems inside buildings, because the complexities within the buildings have just gotten to a point now where you need the kind of the next level of knowledge. And you need people that are doing this, that have an interest in this. And the hot water question, to me, kind of dovetails into that whole concept, because when you look at 5 years ago, the articles that were written, a lot of people talked about elevating the water temperature up to 104 degrees Fahrenheit, using imperial units here in the U.S. And that was the sort of the 32-minute contact time to kill the bacteria, and then up to 160 was your instantaneous kill rate. And it's been interesting because what people have realized as these various committees have been coming out, and these various documents have been coming out, is that those conditions are in laboratory conditions. That doesn't necessarily reflect what is going on in a premise plumbing system with biofilm and scale. And I recall there was a longitudinal study that was done several years ago that showed that that the Legionella bacteria could survive in biofilm for up to an hour at 160 degrees Fahrenheit. And that's not to say that's the case everywhere. It's one data point, but we have to keep that in mind. And that's this challenge now that is presenting the plumbing engineering design community, and also the plumbing contractors. Everyone's really having to up their game as a result of these waterborne pathogens. And things that are in our water that come in from a water supply does affect water temperature. We have phosphates coming in as corrosion inhibitors that'll decrease the water heater efficiency. Turbidity of water that provides locations for the bacteria to hide and will cause disinfectants to be less effective. So, a lot of times plumbing engineers, they'll think of water temperature, water age, and the aerating fixtures. That's kind of their triangle that they have in their mind, the three things they can do to worry about Legionella, but that's just really the tip of the iceberg. Below that, you have water quality. And this is a new concept for a lot of plumbing engineers here, at least here in the U.S. And it's really now becoming a challenge to kind of take a bigger picture look and understand how all these things interact with each other. And then try to find the solution, or the best solution that balances all these competing variables. And hot water is one of those. So I would say, to summarize it, if I was to look at a spectrum of solutions out there, things that we know increases the risk on one side and things that we know will control and prevent. stagnant water, water in the right temperature range, we know that will increase the risk of Legionnaires' disease outbreak. We know that things like copper sulfonization, chlorine, other disinfectants, UV, those will kill the bacteria. But hot water, from what I can best gather from all the information out there, it's kind of in this middle realm. It's maybe a non-risk increase or a risk reduction. And depending on your water quality and all these other factors, that data point for your building will shift from one side to the other. And you have to think through that and what that impact is. And that to me, from what I have seen, that science is still in many ways emerging.
Thank you, Christoph. Getting back to Andy. Gosh, you at Purdue and your colleagues, Andy, are probably among the most prolific researchers on plumbing in the United States. And I'm constantly impressed with the body of work that you guys address and the challenges that you undertake. One of them, it has to do with the National Priorities Plumbing Study. Can you tell us about that, and what are the objectives, and how far along are you?
So thanks for the compliments. So we're just a group out here doing some work with some great people and collaborators. We don't work by ourselves. We work with a number of universities across North America. This study is threefold. One is to improve the public's understanding about low flows in buildings, low drinking water or hot water, cold water flows, because of the drive in the US to basically drive fixture flow rates to zero, to conserve water at all costs. And that's a problem. Utilities are starting to realize this. And so because they're concerned that they're going to deliver water to a building that turns bad very quickly and somebody's going to get hurt. So public awareness is something that we've been working on. We've also done testing in a number of buildings around the country, just looking at different situations. In schools, for example, during the summer, they're really not inhabited. And when we did testing during the summer and watched the transition of fall, we saw 90% of the water samples that we pulled out of that school in the summer exceeded the copper acute health-based standard. And then in the fall, it dropped to 60%. So we see these changes with water use. We see changes in water safety within the building. So we've been working with Michigan State University, University of Memphis, Manhattan College, and others. And then the last part is really the pinnacle of what we're doing, which is we have monitored a home, single family home, right across the street from the university. We collected, I think it was like 6 billion temperature, flow, pressure data points over a year period. We monitored every temperature, every second of every day at every fixture, and flow. So we know where the water is moving and such in the pressure of the system. And we're creating what's called an integrated hydraulic water quality model. Because one of the issues that the federal agencies want is to understand if we change something with the quality of the water entering the building, what will happen to that water when somebody uses it? Or if we increase the pipe length from 10 feet to 40 feet from the fixture use point, what will happen to the water quality at that usage point? So we're creating this model. We'll be done with it in September of next year. And that will be kind of the present that we give to the industry and to the government agencies and plumbing engineering community that's looking for something to start using to kind of give some estimate as to what would happen if you did some design scenario, water use scenario, or what type of exposures do we need to think about in buildings?
As a follow-up to that question, there's a great amount of work being done right now to right-size plumbing systems. It's generally recognized that they're oversized, and there are new technologies that are coming out that are limited to residential right now that will work to reduce pipe sizes, and they are currently available. But how big of a deal is that? When we reduce water age in the building, we increase the turnover in the building as it relates to building water quality? What's the impact?
So I would say that, just take a perfect example of this school, right? This had 300 water outlets. It had copper contaminated water because the water had a high alkalinity content, and high alkalinity water causes copper corrosion. They had a pH of about 7. But anyways, the alkalinity was wicked high. And so the designer didn't know that they needed to pay attention to that. So they designed the building with full copper. The utility is in compliance with all state and federal regulations, but this building has contaminated water. To flush out that building, it takes 4 to 5 hours to remove all that contaminated water. And within 24 hours, that copper bounces back to the level that you need to flush it out again. So really, when we talk about, what is it going to take? We do need to store less water in the buildings, reduce the distances from the water use point to maybe the water heater locations if possible, and also be smart and, as Christoph mentioned, keep the water moving because you want to really minimize the stagnation. One of the issues in this one building we saw, they had 100 feet between the recirc loop and one of the places where we found Legionella contamination. And so that 100 feet is just stagnant, nice, warm water that just sits there. And so really we need better engineering in harnessing the technology that's out there, in innovating new technologies and design methods to make buildings safer.
Thank you.
Pete, if I can also add on, Andrew had a great point there, and I think, real quick, the idea of water conservation, what we've seen over the last several decades, it's a total necessary thing. I'll raise my hand. I'm a LEED A PBD plus C. I live in Arizona. I understand water shortages, and it's an important, and it's something that's a lot of time on the forefront of my mind. But I think what has happened is we've had this mindset, and when I say we, I'm not saying the plumbing industry. I'm saying it seems like general construction. That's this idea that plumbing is simple. And I would echo the sentiments, maybe change the quotation a little bit. The AWWA CEO David LaFrance had said water is complex. I'll say plumbing system engineering and plumbing system installation is complex. Yep. And to think that we can just reduce the water usage in fixtures without going back and changing the way that we've been designing these systems for 70 years now. That's how old the Hunter's curve is. It is missing that holistic approach. And that's where, things that, the water demand calculator or other things out there that are updating the way that we're sizing plumbing systems. And one of the things I'm interested in is learning a lot more about how our European colleagues size their systems. I've heard through the grapevine that places like Germany, my home country, they have different ways of doing these things. And I think that's where some of this cross-pollination between various various entities and various people and professionals becomes so key, because that kind of shared knowledge learning can really have an impact, positive impact on public health and safety.
All right, I'm going to ask one more question to Dr. Gormley. Then I'm going to open it up and get to the questions from the floor. We did have a few come in, some very good ones, and we'll get to those. Dr. Gormley, before we do, one more for you. As a regulator, at IAPMO, now or in the future, where do you see, regulations, whether they be through stricter construction codes, plumbing codes, or health codes? Where do you see these regulations playing a role in combating the potential for disease transmission through wastewater systems?
Yeah, I'm gonna piggyback on the back of the previous two speakers here, actually, because I think the same we got the same situation in the sanitary side as we have in the water supply side, in that these are no longer simple systems, or what people consider to be simple systems, and we can see the consequences of it going wrong. I think it's easier to see the consequences of the drinking water side going wrong, because people become ill very quickly. But I think on the on the sanitation side, I think there is still there is a case that these systems are no longer simple. And I think we have had someone alluded back there to, that we've been doing the same thing for 70 years. Well, I mean, I've done some work and we've been doing some things the same for like 150 years actually. We just made a few little adjustments here and there, but there's no reason why these systems can't move on and include more monitoring on the sanitation side actually. So we don't so we design systems and we say, we're going to limit the pressure in this system, and somebody comes up with a design that's based on a code that was based on something else, and we just assume that it's going to do what we designed it to do. I can't think of any other engineering system where you do that. You design something to meet some kind of a level, and then you just assume that it has done that without ever measuring it. And we get a little bit of an indication because we can see water traps moving and that, and sometimes they blow out, sometimes they suck out. So we can see the really extreme versions of when something goes wrong, but we don't know whether it's within spec or not. It's a very unusual engineering system in that sense from a design. And I know from speaking to designers, especially when we get into really tall or very complex buildings, they're genuinely worried because they have no way of checking if this has really worked, apart from, they get a phone call and say this isn't working, and it's like, it's disaster at that point. So I do think, I mean, we're in the 21st century now. Sensors are as cheap as anything, as they've ever been. Why not, put sensors all over the place, connect these systems into building management systems, collect the data that we can easily get from any other system. HVAC systems have sensors all over them. They're, we can monitor pressures everywhere on them, but we just assume that everything else is okay. So I do think there's a case for just upping the game a little bit on the monitoring of what it is that we're doing, because you often find, as well as designers being a little bit worried about what they've done, and obviously they're worried that it's going to come back on them in a legal way, but you also get the situation where they kind of argue among themselves as to which one was the best, and there's no way of checking actually. So I mean, I do think that increasing some kind of monitoring on that, on those systems, is the way to go. The other element of this, which could open up a complete bag of worms, but I'll throw it in anyway, is that when we look at design methodologies for buildings and building drainage systems, they almost ignore the fact that it's connected to a public sewer. It doesn't really feature, it's like they're two totally separate, isolated systems. And in reality, they have a big impact on each other. Obviously, the building drainage feeds the main sewer, but also they sneakily act as ventilation for the main sewer as well. So we get all sorts of airflows coming from the sewer, and that's not really taken into account. And that can make a difference. And it can also explain unusual events that occur almost inexplicably. And of course, this is building science. It's not inexplicable. It's very difficult to tie it down. So extra monitoring would assist us in finding out the impact that these other systems have on the system that we're trying to develop. And again, I think that is another, it's almost like unfair on the system designer to have one of the interfaces in their system that is almost like an unknown, and they have to deal with it and deal with the consequences of it. So I do think monitoring of the system would be a good start, because it's something that is measurable and recordable. I think other ways is maybe a little bit different. And if we do that, if we can prove that the system, that there's integrity of the system, then we will protect people inside the building from anything that might happen. Because, you know, when things go into the drain, they go into the sewer, they are moving in the right direction. What we need to avoid is them coming back in again.
Well, you know, it really begs a challenge to the WPC, I think, doesn't it? I mean, you know, how do we address this issue of communicating the complexities that are truly associated with the plumbing systems, both on the sanitary side and the supply side, and get folks to pay attention to them and verify proper operation a little bit more closely? Because you're absolutely right. You know, as you said earlier, you know, these pipes are hidden and are under our walls, behind our walls, under our feet. And unless water is squirting out or running onto the floor, in which case everything then becomes the most important thing to pay attention to, you know, going from, you know, not paying attention to it all to becoming the most important thing in your life. But that's the reality of it. And I think it does present an interesting challenge that, you know, I think some thought on the part of WPC would be appropriately applied. So thank you for that response, Dr. Gormley. And I want to get to one particular comment here. This is interesting from Dr. Henry Hung, and I'm going to ask you to please comment on this too, Dr. Hung. Empirical experiment has been done in the University of Hong Kong that indicates COVID-19 virus could indeed be transmitted through aerosols generated when flushing toilets. And this virus is airborne, transmitting to human beings. Would you like to talk about that research a little bit to the group here? And then I'd like to get the you know, some reactions from our panelists.
Oh, sure. Thank you. Give me this opportunity to talk about this COVID-19 stuff. Yes, in the university, we have done experiment using the actual site. We flush water and through the toilet, which is a pedestal toilet. Although there are some squatting toilet in Hong Kong, but you use a traditional sitting type of water closet. And we put some color onto the water, and then when it flush, then we can test using a piece of paper that the water will spray up through the water closet, and that will touch the test paper. That means when we flush the toilet, the aerosol or water vapor or droplet will come out from the toilet. So it shows that if anybody who are infected with COVID-19, and we know that this virus will come out from human body through the feces, and when we flush the toilet, and this virus will go through the water when it goes down to the drain. At the other end, they also come up to the upper side through the air. So when anyone go in the toilet and then they inhale the kind of air, then they could probably be infected. So now the government have a very strong message to anyone: when you flush the toilet, please cover the toilet seat and cover before you flush it, and especially in those public toilets. So this is a very, very important message to the public and also to the plumbing installer when they make sure that the toilet seat and is done well. Now the major problem is in Hong Kong now, because in Asia people they like using the squatting toilet, and as we know, there are no cover seats for the sit and cover for the squatting toilet. So how we are going to tackle this problem? At the present moment, the government just simply lock up those partition with the squatting type of toilet. However, it is not we have to find out a solution how to cover the toilet of the squatting pen. So this is the situation now we have in Hong Kong. I would like to share with you.
We have a similar situation here in the United States. Our in commercial buildings, our toilets typically do not come with seat cover lids. So this is an issue. But even of greater concern on a worldwide level, this whole issue of transmissibility in wastewater, I think, is extremely important to the plumbing profession. Every day, plumbers are cutting into sanitary systems, building drains, stacks, waste stacks, and being exposed to aerosols that exist in these systems. And it seems to me now that, we're kind of still unsure regarding about this transmissibility issue. And while there may be easier, it may be easy to, maybe more easy to point a transmission point to a toilet aerosol than maybe existing in the larger sanitary system. I don't know. But I guess I'll just open this up to first to Dr. Gormley and then to the other panelists as to their impressions of the issue of the toilet plume and the larger issue in general.
Yes, thank you, Henry. Yes, I think there has been quite a lot of research done over many years about toilet plumes and what they may contain. I think there is little doubt that even for SARS-CoV-2 that a toilet plume exists once you flush a toilet, and we do know that the virus can travel in aerosols and in droplets. There's some people believe that the droplets are much more significant than the aerosols, but it can be transmitted in both, and you're absolutely right about that. I think we still lack that last vital piece of information, which is the infectivity of the feces and the urine, and if we get that, if that was proven, then I think the situation in relation to how serious people take the transmissibility in bathrooms and in toilets would be it'd be a lot easier to convince people. I think at the moment it's a little bit difficult to convince people because of that. But I think even regardless of COVID-19, these toilet plumes exist. And other bacteria and viruses may be contained in them, and they are a health risk. There's no question about it. So whether SARS-CoV-2 is infective in aerosols from a toilet flush is almost neither here nor there. The plume exists and it can contain pathogens, and therefore the type of mitigation strategy which you were talking about in Hong Kong of putting down toilet seats is very sensible. It does, as you say, pose a problem for situations where there is no cover, but perhaps there needs to be some kind of cover, regardless of what the norm is in the place, the type of toilet. The squat toilet, it doesn't really lend itself to it, but perhaps it needs a modification in order for that to happen. I know here as well in hospitals, there are no toilet seats, and very often there are no toilet seats because people feel that they can become contaminated themselves. So you've got this conflicting sort of contamination route going on here. But I mean, just as a matter of equivalence, we published a piece of work. Well, it's in a preprint at the moment. You can go and have a look at it, which quantified the size, distribution, and number of particles generated from a toilet flush inside the toilet, inside the drainage system, not actually in the room, but it would be equivalent. And we calculated that from a single 6-liter toilet flush, the number of particles that were generated in aerosols and droplets, it was the equivalent of someone talking loudly for 6.5 minutes. So people understand that if you were standing right beside someone and they were talking at you very loudly for 6.5 minutes, there's a risk. There's a clear risk. And this is what is coming out of the toilet, or this is what is being generated by the toilet. So it is something that needs to be taken seriously. The argument is still going on, and I've been working on aerosolization of virus in my own lab, and we're hoping to have some results quite soon. But these are difficult pieces of work to carry out, and you can't just do them overnight, I think is the is the thing, but it's worth doing, I think.
That's great.
You know,
I'm sorry, I'm going to have to cut this short. I think we're running out of time, and I do want to give our chair the opportunity to provide some closing comments, but we're 5 minutes before the top of the hour, and unfortunate, because this was a great discussion. Before I turn it back over to Chairman Bigley, though, I want to give my profound thanks to our 3 panelists today. Michael, thanks so much for staying up late, buddy. I really appreciate you, more than I can say, and that's really above and beyond. Andy, thank you, my friend. I appreciate that your involvement here as well, and Christoph, thank you for your participation as well. All great contributions. I hope you paid attention to some of these questions that we didn't get a chance to ask here in the margins. What we will do is we'll try to capture some of this information and share some additional content with the attendees after the conference is over, and see if we can continue this discussion a bit after the fact. So thank you again, and back to you, Chairman Bigley.
Thanks, Pete. As always, you always come through, and on short notice, you did an excellent job of putting the panel together. Dr. Gormley, Dr. Whelton, and Christopher, thank you for your time. I agree with Mr. DeMarco. I think we could have talked for a few more hours about all these things. So thank you very much. That concludes our program. I want to thank all our speakers today, and thank for everyone for participating in the WPC PC's virtual general meeting. This session was recorded, and it will be available at the WC website, and it'll be linked to our YouTube channel. I'm going to say special thanks to Gabrielle Davis, Secretariat of the World Plumbing Council. Thanks, Gabby, and her associate, Letitia Galagos, and to everyone at IAPMO behind the scenes, the IAPMO staff who have been instrumental in making this possible. Thank you very much. Thank you, Dave Viola, for lending the staff for the World Plumbing Council, and Russ Shaney. Thank you very much. And everyone, please be safe out there. And I wish everyone a happy and holiday and safe Christmas and New Year's. Bye, everyone.